Welcome to the Art of Healing with your hosts, Dr. Judy, Jasek of Animal Healing Arts and Matt Rowe of ParsleyPet. During our show, we are talking about your pet's health, raw feeding, and an alternative treatments for cancer, unexplained illnesses, and supporting your pet's natural ability to heal. Welcome, Dr. Judy, to this week's show.
Thanks, Matt. Happy to be here. And I'm really excited about our topic because it's so important for the health of our pets.
It's something that I'm passionate about, you're passionate about. When you take a look at what is happening today when we take our pets into the clinic and we take our pets in to get treatment, they recommend a vaccine. And this is what we're going to talk about today, our vaccines. When, why, and how much. And I noticed just on this topic, when we started talking about it, is when we go through this, is every time I go to my vet, before I go to this awesome vet by the name of Dr. Judy, this is something that they said every time. Okay, yep, they're due for this round of vaccines. And it was every year they were getting a new slew of vaccines. So, in my education, everything that I had studied about it for my own children and for ourselves, is we looked at it as the incidence of how much it's starting to happen and some of these health issues that are starting to spawn, which may be related to it, but we don't know this. And so how do we make the best decision possible for our loved ones and for our pets? So that's what we're going to talk about today. So Dr. Judy, talk to me about vaccines, because you are more passionate about it than I am.
Oh yeah. And I honestly believe through my own experience in practice is that vaccines cause a large number of diseases, chronic inflammatory diseases, or at least they're a big contributing factor. And I think they're way overdone. So I think, first of all, if we just get down to the basics of what is a vaccine. So a vaccine is designed to stimulate antibody production. So say you vaccinate against a certain virus or other type of microorganism, and what's in that vaccine is a killed or modified live form of that organism. So it's designed to not infect the pet with that organism, but stimulate this antibody production is what vaccines are designed to do. And they can do that. And we know that because some of the, more common vaccines, we can actually run titer tests and actually measure the antibody levels. The big thing about vaccines is once the body builds these antibodies, that immunity doesn't go away. And most pets are going to be fully protected if they're challenged with those organisms, which means that this need there is no need for these boosters year after year after year in a lot of the common vaccines. Now, some of them are not, or we can't run titer tests like on things like lepto, which is very, very commonly given. And that's given every year. We don't have a point of reference for that particular vaccine, but that particular vaccine, there's many different forms of the leptoorganism, and the vaccine only covers a few. And I see such a high reaction rate to that vaccine. I haven't given it in years, and I don't ever recommend giving that particular vaccine because the reaction rate is so high. And the other thing is our dogs and cats, they have an immune system that's perfectly capable of eliminating pathogens, bacteria and viruses and other microorganisms if they're kept healthy and they're kept on a healthy diet, so that, further minimizes the need for the vaccines. So what I do in my practice, if I'm starting with a young animal, say a puppy, first of all, I do what's called monovalent vaccine. So I only give one component at a time. Most vaccines are big combination shots. You're giving 4, 5, 6 things at a time. So I only give one thing at a time. And then I recommend titer testing after just one round. And about 85 to 90% of puppies will have a good antibody level after just that one round of vaccines. And then if they don't, then we just give the component that they need. We don't keep repeating these big combination vaccines, because I think it really, really hammers these young immune systems. And I think sometimes does permanent damage to them.
Yep. And this is something that, you know, when you're looking at it, anytime you give a vaccine, you are taxing the immune system. You're basically making the body fight this antibody that you put into it, but that antibody is a very low level, and you have to stop me if I'm incorrect in any of this, is it's a very low level, so the body is able to adapt and build the antibodies to fight that pathogen, or not pathogen, but fight that virus that may come into the system. And so really, when you're looking at that, when you influx the body with 3-4 vaccines at once, you're making the body go into overdrive on actually having to repair and stop all of it. But then you talked about some dangers of vaccines. So is it the stabilization agent that they actually put into the vaccine to stabilize it, to make sure that it is, you know, it's viable and stuff like that?
Well, I think that could definitely be contributing. They still put mercury in vaccines. I do have a mercury-free rabies vaccine.
Okay.
For people that, you know, do like to keep their pets current on rabies, because there's regulations there around that vaccine. So I do have one that's mercury-free, but they have preservatives, antibiotics. There's chemicals, and you know, there's not always complete truth in labeling either, because some of these things, they don't have to put it on the label if it's below a certain amount, but it can still be there. And there's no like real good amount of mercury to be putting in the body, especially injecting it. I think the other reason that vaccines cause such reactions in the body is it's not a natural route of exposure for the antigens, for these, you know, organisms that we're trying to protect against. So you take something like parvo, which is an intestinal virus, mostly in puppies, and they get that naturally through a fecal oral transmission, meaning they're exposed to the stool of a dog that is infected with parvo.
Sure.
When you do a vaccine, you're taking that antigen, you're injecting it. And so there's a you know, a process that the immune system goes through when it's exposed. So the puppy takes in some parvovirus into its mouth, and then it's exposed there, and kind of alerts the immune system. And there's this whole cascade of events that happen for that immune system to engage and to fight that virus. Well, when you inject it, you are bypassing all of that natural function of the immune system, and you will get antibodies. We can measure it. You do get antibodies, but then the body has to clear that antigen and all the other chemicals that are in the vaccine. And sometimes it can't do that, you know, that readily, especially when really, really young animals are vaccinated. I really try not to vaccinate until they're like 9 or 10 weeks old, so they have a little bit more of a mature immune system, because the immune system is still developing in young animals. So then the immune system kind of doesn't know what to do. It's got this stuff it needs to eliminate. So how does the body eliminate things? Well, it sometimes will detox through the skin, or, you know, when we get rashes and itchy skin, or it'll detox through the gut and we can get diarrhea or vomiting. And then when you compound that by giving, and a lot of, you know, the vaccines are given, like I said, at 4, 5, 6 components. So then in a young animal, and you're giving that same shot 3 weeks later, and then 3 weeks later, and 3 weeks later. And, you know, a lot of these protocols are 3 and 4 booster shots. And so that immune system ends up just, it doesn't know what's friend or foe, literally. And we a lot of times can end up with chronic inflammatory disease, autoimmune disease, and things like that, because the immune system is still developing in the young animal, and now you've completely disrupted it. And I think that disruption sometimes is permanent, in that we have conditions that we end up needing to manage, sometimes for the life of the pet. Especially if they're on, you know, a kibble diet, which is inflammatory. So you have the inflammatory diet, and you're throwing all these vaccines on top of it. And, you know, I see some of these poor pets, you know, young dogs, just so like itchy skin and rashes, and
Yeah.
they don't have good stools, they don't have good digestion, and they're just a mess, and they'll be like 1 or
Yeah.
2 years old. And I know this is
Yeah.
why. And it's like you were saying, Matt, the veterinary profession anymore, it's hard to walk into a clinic for anything without them sometimes
Hmm.
insisting that your pet is updated on vaccines before they will
Hmm.
do any procedure. And the two
Right.
are completely unrelated. There's
Yeah.
there's no reason to be requiring vaccines for any
Hmm.
sort of medical procedure
Yeah.
except to make money selling them.
Yep. And this is sad because you'll see a dog come in that's not healthy or sick or has some sort of an ailment, and while they're sick, they're just like, oh yeah, while you're here, let's just
Yes.
get this vaccine taken care of. But then you're already taking a body that's had a taxed immune system that's fighting something else, and then you're going to add another layer in there to make them fight whatever vaccine that you're putting into their body, whether they need it or not. And
Right.
so I
And
love, yeah.
yeah, I was going to say, and with, especially with anesthesia procedures, animals can be healthy. They go in for a spay or neuter.
Mhm.
And, the anesthesia is stressful on the body. And
Mhm.
sometimes we need to do surgery. Sometimes that's necessary. But then
Yeah.
you add the vaccine on top of that. And then we wonder why pets don't recover well from anesthesia.
Yeah.
They have problems after these procedures. Should
Right.
never, ever give a vaccine on the day of a procedure like that. And like you were saying,
Mhm.
in particular, if they're sick, and I see this all the time, I see cancer patients being vaccinated. I've now, trained myself to be sure to tell people, don't ever vaccinate your pet
Mhm.
with cancer, because a lot of people just don't know. And then they go in.
Right.
A lot of my clients have other vets
Mhm.
for other needs or closer to home, and they'll go in and they get vaccinated, even though they have something as serious as cancer. And
Yeah.
it shouldn't be done. It's, in my opinion, it's
No.
highly negligent. And
Mhm.
Colorado does allow a rabies exemption for medical reasons.
Mhm.
And I think a lot of people aren't aware of that if your pet is sick and it's due for its rabies, that we can actually write a rabies exemption. But I hear that a lot of vets won't give it to them, which
Yeah.
is too bad.
But you started to point on something important it's a revenue source for them. It's a way for them to make money inside their clinic, and they're small businesses, and you feel for them because they're fighting so hard to have their clinic be successful and to make enough money for themselves and their family and all of this. And vaccines are just one of those angles that they can go after to actually bring in more of that revenue. And essentially, they're going to provide a vaccine for your pet, whether they need it or not,
Right.
because it follows that revenue stream. And they're not taking a look at it saying, you know what, we are, let's hold off on that at this time. Your dog shows levels of cancer or has, propensity of this is happening to them, or they have some other ailment that they, are coming in for. And so then they're going to vaccinate just to get it on the books so that they can, generate more revenue. Not saying that's bad, but giving vaccines along those cases in those moments, I think are bad. And
Oh,
so it's fine to run a business, it's fine to grow a business, but then if you're looking at affecting the health of your pet in the long term because of it, I don't think that's right. And we've got to think about it differently as a society. Yes, it's important, but
right. And I think, pet parents need to advocate for their pets.
mm-hmm.
You do have the right. This is actually written in the Practice Act, the Veterinary Practice Act here in Colorado, that clients have the right to informed consent. So that
Mm-hmm.
means that people should be fully informed of all the pros and cons of any procedure or any
Right.
medication given. And most of the time that doesn't happen with vaccines. People are told, they're given something to be afraid of, is
Yeah.
what happens. They're like, well, if you don't give this, then this or this can happen. And they're
Mm-hmm.
never told about the side effects, the other chemicals that could be in
Mm-hmm.
that vaccine.
Yep.
None of that is mentioned. It's rarely mentioned. So,
Mm-hmm.
I really would like to empower pet parents to become educated and know what your
Mhm.
pet is getting, and ask, why does my pet need this vaccine?
Yeah.
Is it really necessary?
Mhm.
What are the potential side effects?
Mhm.
And start to ask some questions. Don't just blindly believe that everything that's recommended is in your pet's interest. And it's not
Yeah.
that I think veterinarians are malicious. This has just become the standard of care in a lot of veterinary medicine. And I don't practice that way because I look, when I see a sick pet come in, I look at their history and how long ago did they have vaccines, and does that coincide with
Right.
their condition starting? And
Mhm.
so many times it does. My assistant, I have a new administrative assistant, and she even said, because she puts a lot of the records in the
Mhm.
computer and puts charts together for me, and she said, I can't believe how many pets that are newly diagnosed with cancer that have had a full round of vaccines within the last 6 months. So this isn't like it's an automatic, immediate
No.
reaction. It can be something that occurs months on down the line, and it's
Right.
probably not the only contributing factor to the
Mhm.
development of something like cancer or autoimmune disease. But I think it can definitely be the tipping point. The pet's kind of there, the body's inflamed, they're maybe not on a really
Mhm.
great diet, and then you wallop their body with vaccines, and then that's it. The
Yeah.
immune system just can't manage anymore.
Yeah. I know with what we do, we take a look at 7 different heavy metals in the body. And whenever we see, um, and we ask in our intake form, when was the last time they received vaccine? And that we want to take a look at that, because if we see high levels of mercury, what's interesting is that is almost directly attributed to the amount of vaccines that they were receiving.
Mhm.
So it's like, for example, in the last 6 months, if they did a full round of vaccines, you're most likely going to see mercury at a high level inside the body. But what mercury does is that can cause seizures inside your pet.
Right.
And
Yep.
so, really, once we identify those pieces, our vet recommends chelating out or removing out the mercury as best as you can. And we do it with whole food ways to remove it, and it loosens up the mercury. And then you have the binding agent like a dulce flake, which is Atlantic sea kelp, that binds to the mercury and then allows the body to pass it out. But mercury is nasty. Mercury never
Mhm.
leaves your system unless you give it something
Right.
to attach to. It
Right.
just looks for the next thing in the cycle. And what mercury does is we have all these receptors inside our body. And if there's a receptor that our body is looking for whether it's in the brain or whether it's in another part of the body, mercury just assumes that role and slides perfectly right into it. But
Yeah, and
then,
I think
yeah,
that's a real important point that you're making too, Matt, that it doesn't just go away. Like you have to actively remove it,
right.
from your body, and there's,
Mm-hmm.
people that get mercury toxicity too, and you have to chelate it. You have to,
Mm-hmm.
put things in the body that the mercury will bind to and then
Mm-hmm.
be excreted. So once you
Right.
start pumping these vaccines in, it just builds and builds and builds and builds and
Mm-hmm.
builds. I know I had my
Yeah.
mercury fillings removed here a few years ago. I don't know, probably 5 or 6 years ago now, but I
Yeah.
had, when I was a kid, that's what they put in. The silver
Right.
fillings were mercury. And I
Yeah.
just heard so many scary things about it that I actually
Mm-hmm.
went to a holistic dentist that would remove them and took out the
Mm-hmm.
old fillings and, replace
Yeah.
them with new ones.
But as a society, we still put mercury, and it's such at a small level, they kind of get away with it. We still put mercury in vaccines to stabilize it. But
Hmm.
they're saying, oh, it's such a small level, it's not going to make a difference because we have no studies that show that this is an issue or anything like that. But the issue with that, when you walk down that road, is that we're now giving vaccines at a regular basis to our pets because of either it's a revenue reason or it's just a protocol process reason from a big vet clinic that may be promoting, this is what you have to do when you come to the practice is get this level of vaccines, or you have to follow this schedule of vaccines. And now the pet is just getting inundated over and over and over again. And the mercury may be just one small piece, but I love how you put in diet is a big factor of it. because if you're feeding a kibble-based diet, your dog is inflamed. I can guarantee right
Yeah.
now in their stomach, if you feed kibble, your dog is fighting that inflammation that comes in and that lack of being able to digest all the nutrients it needs within its body, because it's not a natural diet. It's not something that they would want to actually go and adopt or get into that side. Then we throw a vaccine on top of that. So now I'm inflamed. Now I'm struggling, like trying to digest food, even though we may not see it. Then we put a vaccine on top of that. And then all it may take is one other piece of an injury, or they eat something outside that their body is not supposed to be eating, or they eat a chemical, or they eat something accidentally inside that goes through them. And then now it becomes the perfect storm. And it may lead to seizures, or it may lead to other ailments that are unexplained that walk down that road.
Yeah,
And
there's
that's
an
the scary part.
yeah, there's an additive effect, just like there's an additive effect to doing the right things. You know, you do a good diet, maybe add in some supplements and all these different things, help create a healthier pet. There's an additive effect for the toxic things and the things that create inflammation. So if you have, you know, your pet's on a kibble diet and they're getting vaccines repeatedly, and they're on, you know, heartworm prevention and flea and tick prevention, and they're getting all these, you know, chemicals. Sometimes they're on, you know, pharmaceuticals for itchy skin. And all of this stuff is just so hard on the body. And then, like you were saying, they just get closer and closer to the tipping point. And is it just that one vaccine that causes the cancer or causes the autoimmune disease? It's not, but it does. It's the final straw. You're just building this inflammation. And you know, we live in a toxic world. Like, you can't completely get away from things like glyphosate and chemicals and pollutants in the air and things like that. There's definitely things that are out of control, but I think that makes it even more important to work on the things that we can't control. So you can minimize vaccines. You can feed your pet a better diet. You know, you can do some whole food supplementation to help support their immune system. There's herbs and different things that can help with that. So there's a lot of things that we can do to support your pet to give them the best chance. So then if their body does get exposed to something out there in the environment, or out on a walk or whatever, then their bodies can process it and can eliminate it, because the body can eliminate toxins. But when it gets to the point that it just gets so overwhelmed, these metabolic pathways just can't work properly.
There's nothing you can do at that point. So for everybody that's watching this, what do you recommend? So I'm going to throw it in my cases. Let's say I have a pet, and my pet is, you know, 2 years old, and I'm going back to the vet for another round of vaccines that are potentially coming. What should I do as a pet owner to help my pet stay happy and healthy?
Well,
feeding raw first.
Yeah. So diet is, of course, and we've talked about that. So diet is important. But as far as vaccines go, when I see a pet like that, I recommend, let's do a titer test. Let's see where they're at. Have they already built an immunity to these vaccines that they've been given? And if so, then there's no need to give them again. For the vaccines that we can't do titer testing on, like the kennel cough vaccines, influenza, I don't recommend those unless you're putting your pet in a facility and they just absolutely will not let the pet in without them. Because every, you know, as we're saying, every vaccine has a potential to create more inflammation in the body. And the thing about like the kennel cough, that Bordetella vaccine that pets will get, that's like you or I getting a cold in an otherwise healthy pet. It's not a life-threatening illness. So unless the facility absolutely requires it, I just don't give it. And besides, almost all coughing dogs that I've seen have had that vaccine. So I don't think it actually does any good. It's just something for some of these facilities to kind of cover their bases. So we can do, titer on the basic core vaccines. And then we look at, okay, is the pet at any real risk for getting anything else that we might want to add in? And again, I feel strongly that rather than pumping them full of vaccines, let's work on building their immune system with a good diet, maybe some whole food supplementation, and that's going to keep the pet healthy. Your pet's immune system can handle disease exposure and eliminate it. Rabies is a little different because there are some regulations there.
Mm-hmm.
So if you want to keep your pet, current
Mm-hmm.
and, per the regulations where you live,
Mm-hmm.
then rabies should only need to be given every 3 years. And I
Right.
look at it that if you can do a rabies titer, but in most areas, it's not a legal substitution for the vaccine.
Yep.
But I look at it that, if that's the only vaccine you're giving your pet is that
Mm-hmm.
rabies shot every 3 years, and they're on a good diet, we have them on a, healthy routine, their immune system is strong, then they'll probably be okay. They'll probably
Yep.
be, okay with that. That's a choice that, people need to make. And if your dog does bite somebody and doesn't have a current rabies shot, it can be taken in quarantine. So there are some bigger consequences for not having a current rabies.
Sure. And then if they do rabies, you can get a vaccine that has no mercury in it, a mercury-free vaccine. So then it's definitely explored that. And then you had said, is the right word monochromatic?
Monovalent.
Monovalent is a monovalent. So it's only the rabies vaccine that you're giving. So you're not giving a slew of 3 or 4 different types at once.
Right.
Yeah.
And I think that's what really messes up a lot of pets' immune systems is they'll be given the combination shot will be parvo, distemper, adenovirus, parainfluenza. There's a coronavirus that dogs get vaccinated against. They'll throw in lepto and they'll throw in rabies. So they're getting 7 or 8 things all at the same time. And it's just so hard on the body.
Yeah. So definitely take your time. If you're looking at vaccines, take your time, do your research, do your homework, be your pet's advocate, step in front of this and really make sure that you're making the best move. And start is just like Dr. Judy said, is you're going to take a look at doing a titer test first. There's some vaccines you can't get around, and we understand that, but like rabies is a big one. Make sure it's a mercury-free vaccine and it's a monovalent vaccine that doesn't have a slew of 4, 5, 6 others inside of it. It's really just the rabies vaccine, and to make sure that you're good there. But really go through and make sure your pet is getting what it needs. And the big step, start with a healthy diet. Start with building that immune system up. And your dog should be eating raw. Your dog should be eating food just like it did 100 years ago. It hasn't evolved in 100 years. And really feeding it like it would if it was in the wild. It's got these big, long, sharp teeth called canines for a reason. It's meant to grab and hold an animal and eat the animal. It's the way it is. And this is just along some of these processes. When we feed it a kibble-based diet, it is dried equivalency of you eating cornflakes every day. And it's a lot of synthetic vitamins and minerals. And this is something your dog doesn't digest very well. It doesn't, meant to eat that. So then that taxes the immune system even more. So really helping your pet to stay healthy. Yes, vaccines are important, but help them support the other side as well. So if you do have to give it, they have every ability to build up those antibodies and stay as healthy as possible.
Yeah. And you should, your veterinarian should offer you the opportunity to have a discussion about your pet's lifestyle. Where does your pet go? Where do you travel with your pet? What are its real risks? And which, if any, vaccines are really necessary. And I don't think those conversations hardly ever happen. Right. I have them with clients, but from what I hear, otherwise they don't happen very often. And that's again where I think it's so important to advocate for your pet and ask the questions when you go in. Why is this vaccine necessary? What are the side effects? And see what they tell you. What ask what preservatives are in it. What's in the in the package insert. What else is in there besides these antigens that we're trying to protect the pet against? And ask some good questions, and then you'll be informed, and probably the people in the clinic you're at might learn a thing or two as well.
Yep. And I think that's beautiful. So this goes right into why you need to contact Dr. Judy and why you need to have Dr. Judy as your vet is because she's going to take the time with you. So what's the best way somebody can get a hold of you?
Well, our website is my practice is called Animal Healing Arts, and my website is ahavet.com, and you can learn a lot more about our practice there. The email is info@ahavet.com, and the phone number is 720-515-2421.
And I highly recommend that you reach out to her. You know, before I started going to Dr. Judy, I, went into the vet, and it was the classic vet visit. You walk in, you got maybe 5 minutes with the vet, and they're firing questions and you're firing answers, and you go back and forth. And then they leave the room and the vet tech comes in, administers shots, and I'm gone. The difference is when I actually go to the vet with Dr. Judy, she asks questions about how Leo's doing, where have you guys gone, what are you doing now, what do you notice, is there any, and she really drives deep on the details in regards to what my pet is experiencing, what I'm experiencing with my pet, and what have I noticed. And it brought so much peace of mind for me when I went and actually started to have conversation with Dr. Judy's. I felt empowered. I felt like I was basically being my dog's advocate. I was being Leo and Mr. Chacha's advocate, and I felt like a better pet parent as a result. So I highly recommend reaching out to Dr. Judy and explore that, just for the health of your pet, and to make sure that you're making every decision possible in the best way that you can. And you can also reach out to us at ParsleyPet.com. The nutritional blueprint will tell you 7 heavy metals along with 48 nutrients inside the body that may be affecting health. And in some cases, we see mercury. Elevated mercury levels, and this can point to maybe a seizure incidence that's going on with your dog. So with all of that, it's everything we're doing. It's why we do this show, is we want you to have the healthiest pet possible. And we want you to know, we want you to have that peace of mind at the end of every day. So thank you, Dr. Judy, for being on the show today. I really appreciate this conversation. It is one of those that is, it's important, but often not discussed very much.
Yeah, I think nutrition and minimizing vaccines are the two most important things you can do for the health of your pet. I have believed that for a long time, and the more I practice, I just see it proved out over and over and over again. So it really is super important.
So before we get off, you are actually, somebody invited you to give a class tonight. Tell me.
Yeah, I'm doing it's on vaccines, which was kind of coincidental. I didn't even think about that when we picked this topic last week.
Awesome.
But yeah, sponsored by Ken Carroll Pet Spa here in Littleton, and they have a pet education center, and I will tell you the address. It is, where did it go?
So if you're based out of Colorado at all, head to Littleton tonight and go see the Ken Carroll Pet Spa. And she's going to get you the address. Yeah,
it's not at the Ken Carroll Pet Spa. Oh, there it is. I'm just looking on my Instagram for the address. So the address, they have a separate education center here in Littleton. And so it's 7961 Schaefer Parkway. And that's here in Littleton. And
7961 Schaefer Parkway, Littleton, Colorado. Tonight, see Dr. Judy. And I have a feeling they're all going to be wearing masks, and they're all going to be practicing safe social distancing and following all the rules and regulations of bringing people together in today's day and age. So
I'm sure they will.
Concerned about that, is you're really going to take a look. But you can actually have a one-to-one conversation with Dr. Judy about all of this. Just contact her clinic and take those next steps, because yes, you have options as a pet parent. So thank you again, Dr. Judy, for the show today. Awesome. Awesome
Thanks.
topic.
Thanks, Matt. Happy to be here as always.
All right. We'll see you guys. Be really good, and hug your pet for us, because they're awesome. All right. See you guys.